Hi, everyone. Thank you so much for tuning into this month's meeting of our remote monitoring working group. We've got a couple updates and opportunities today. First, an inquiry we got from some researchers at Brown University that are looking for folks to participate in. A recap of some of the top takeaways from our webinar we had earlier this month, going over some of the status of OIG investigations targeting RPM billing, and then a handful of top policy developments in the health policy space that I wanted to flag that we're keeping an eye on in case they may affect you as well. And then our usual member discussion, highlight of our ongoing efforts to fund RPM research, as well as a few upcoming events we have. So late last week, we got a message from some folks at Brown University about a research project they're working on with doctors Ativ Marota and Mitchell Tang. Dr. Marota, of course, joined us earlier this month for our acute hospital care at home roundtable and has participated and presented at a handful of other CTEL events. They got some funding from the Peterson Foundation to develop a new set of remote monitoring reimbursement codes due to poor alignment with value and high complexity. They're aiming to deliver a concrete set of policy recommendations for the Centers for Medicare and Medicaid Services to incorporate into future rulemaking. CMS has demonstrated some interest in reforming some of their remote monitoring reimbursement. They issued an RFI in the physician fee schedule last year that CTEL responded to and has demonstrated some interest in other areas of digital health reimbursement like software as a service coding. And so this is an effort to bring to CMS some insights into how they can better model their billing to reflect actual provider practices and the needs of clinicians. And so they're looking for direct insights from frontline providers who bill Medicare for RPM services. And they want folks to reach out directly to the research team. So if you're interested in taking part in this study and sharing some of your perspectives, it's looking like they'll schedule just a short one-on-one Zoom meeting with you to gather some of your insights into billing for remote monitoring. So if this is a research study you're interested in participating in, you can email Lori_Usher@brown.edu. Any questions on this? Next, I wanted to cover some key takeaways from the webinar we had earlier this month with Natalie Lorenz from Powers Law, talking a little bit about some of her insights working on some of the Office of Inspector General investigations, looking at some potentially fraudulent RPM billing practices. This is something that was identified in a report published a few years ago highlighting some concerns about billing practices related to remote patient monitoring. And so since then, OIG has conducted a number of investigations on practices, and they have been looking at 5 billing practices as potentially being problematic or as indicators of needing additional investigation. These, of course, don't automatically mean that a practice is engaging in RPM fraud, but these are the top 5 areas that OIG is looking at to warrant further investigation. The first being spikes in new patient enrollment, as well as billing for patients without a prior patient relationship, as well as billing without treatment management, multiple providers billing for same patients, and billing multiple devices for patients. And so these are areas that if your practice is potentially doing these, that you may want to engage in some increased documentation or ensure that your billing is compliant with reimbursement rules. Natalie also shared some recommendations for providers, first being to audit and ensure accurate coding for RPM services, making sure to document all components of RPM services and billing, develop practice policies on the use and review of RPM billing, and finally to provide training on RPM coverage and billing requirements to ensure that billing is being done properly. The full webinar includes some broader discussion on some of the background about these investigations, as well as some additional insights. Those are available on through the CTeL member portal under Content Library. Any questions or comments on this?
Yeah, Lydia Tyrus, how prevalent are these OIG investigations right now?
It doesn't seem to be uh like a major like strike force or anything that they're leading. But there is an area that OIG has targeted as being a prevalent area for potential fraudulent billing activities, kind of coinciding with the increased uptake and utilization of remote monitoring services. So this is something that the OIG is actively pursuing. Um, and these are kind of the top five areas of billing practices that they're looking for as they work on these investigations.
Thank you.
Any other questions on this? Finally, I wanted to highlight some, I guess, smaller areas of policy developments that we're still watching that may ultimately have an impact on some reimbursement and compliance needs. The first is that both the House Ways and Means and Energy and Commerce committees are exploring physician fee schedule reforms. The Energy and Commerce Committee held a hearing with some leaders from physician associations talking about some of the challenges in the current physician fee schedule structure, as well as the Ways and Means Committee holding a markup of a number of bills, including one that would target some of these fee schedule reforms. Big ones being modifications to the budget neutrality requirements, which require that any change in spending on the Medicare physician fee schedule be offset by cuts in other areas to ensure, I believe it's about a $20 million threshold that must be crossed for this to take into account. This would seek to change that threshold so that any new codes or new utilization patterns don't require massive changes in other areas, which has been a major issue in a lot of the conversion factor cuts that we've seen in recent years. Similarly, it would seek to stabilize changes in the conversion factors. I believe the number that was being proposed is 2.5%. And so under this bill, CMS would only be able to change the conversion factor by plus or minus 2.5% from the previous year, hoping to increase some stability in terms of physician payment. This is still in pretty early stages, but the fact that there are hearings as well as markups of concrete bills, there may be potentially some reforms coming to the physician fee schedule and Medicare reimbursement for physician services. We're also expecting that there may be some new HIPAA rules, both HIPAA privacy rule and HIPAA security rule regulations. There were some proposed rules issues in recent years that the Trump administration has taken an interest in taking up. This was something that when CTeL met with the secretary's team last year at HHS, they had discussed that they were looking at their options for issuing some final rules regarding HIPAA. And so there's been increased interest from the administration in issuing these, as well as some activity in terms of regulation as it's moving through the process through OMB towards a potential final rule coming out soon. And also, congressional Democrats are looking to use the Congressional Review Act against CMS's Wiser model. So the Wiser model was introduced by CMS last year, which is hoping to use artificial intelligence to conduct prior authorization reviews. The Government Accountability Office recently issued a decision that this model constituted a rule that was subject to congressional oversight through the Congressional Review Act. And so congressional Democrats have introduced a joint resolution of disapproval, looking to overturn and block the rule from taking effect any further. Finally, another major update that came in the past week is that Senator Bill Cassidy of Louisiana lost his primary election. Senator Cassidy, of course, being the chair of the Senate Health Committee, has had a major influence in the direction of health policy in the Senate, although he has also had a contentious relationship with HHS Secretary Kennedy, as well as the MAHA agenda, which has made him a target from the president to seek to replace him with with a senator that is more in line with those agendas. And so he has since lost that primary, and so new Senate help leadership is also up in the air, and we're likely to see a different direction come the next Congress. Any questions on some of these policy developments that we're tracking?
No change, no questions. Is more of like, ugh, what else?
Yeah, we're expecting the budget process to continue moving through as well. Of course, the continuing resolution went through this September. Fortunately, this time around, if there is another shutdown, um, the telehealth waivers have been extended through 2027, so those won't be immediately impacted by a shutdown as well. Um, but that's also something that we're keeping an eye on as well.
Thanks, Libby.
Any other topics or comments that we didn't discuss that we'd like to discuss today? Again, I just wanted to plug our ongoing efforts to fund some research regarding RPM. This will be similar to our telehealth cost impact study that was recently published in the Journal of Telehealth and E-Medicine. Um, Looking at the economic impact of RPM, cost savings and utilizations, clinical quality outcomes, as well as any program integrity concerns regarding RPM. We are still actively seeking funding for this research project. If you're interested in contributing, feel free to reach out to me or Krista, and we can share some more information about this as well. Finally, we've got a couple upcoming events that I wanted to flag for you all. First being a webinar from following up on our roundtable we held last month about some of the policy issues facing femtech and queer digital health. This one will be focused on market opportunities and growth strategies and will be more of a webinar format. And then later in June, we'll be heading up to New York City for an in-person roundtable focusing on the digital health market, how federal and state policy dynamics shape market transactions, investment, and business decisions as well. Registration for both of these is available on the CTeL website.
Lydia, do you know if there's been any more consideration given to the June 25th symposium as virtual?
I believe it is still in person only. And with that, that's all that I have for today. If you have any questions, feel free to reach out to me or set up some time to meet. Thank you so much.
Thank you.